My name is Dr. Will Posten, and I'm a Mohs surgeon at Advanced Dermasurgery Associates, part of Platinum Dermatology here in Dallas, Texas. I've been practicing here for 22 years and mostly focusing on skin cancer, and we also do surgical dermatology as well, which includes the treatment of keloids. In most studies that are done in dermatology and I think most fields of medicine, we look at a 5-year endpoint, just arbitrarily pick that. And, my understanding is studies have been done that have basically shown a 90% success rate at the 5-year time point. And we'll see patients for long-term follow-up for 1, 2, or 3 years after we've done this, and we have not seen recurrences. Often it does happen, and this is one thing that I tell all patients is, this is not a 100% technique, but I think 90% is a pretty good number to see, which is a vast improvement from what used to be available. Yeah, so this therapy, my opinion, and I think what studies have shown and what we see is it's much higher, has a greater chance of success with a much lower recurrence rate. I mean, intralesional corticosteroids, I would say, have a recurrence rate of 90%. Cryotherapy, probably along the same lines. Laser, not much different as well. Whereas this modality would have a recurrence rate of about 10%. I think a lot of that is due to the fact that the radiation does have a very suppressive effect on inflammation and fibroblast growth, which basically makes this really help with this. Adverse effects, there are adverse effects with using radiation, but we don't see that often when we treat keloids. I do see the risks and side effects with radiation when treating skin cancers, but have not really seen that with keloids. It can happen. In terms of patient adherence, this is a key point actually with this modality. It is very critical to do the radiation immediately following the surgery. And to that point, we tell patients during a consultation that it's a very strict 4-day protocol for doing this. We do the surgery on a Monday, and then they have to get the radiation on Tuesday, Wednesday, Thursday. And we tell people that if you miss any of those days, that 90% cure rate or success rate that we quote dramatically goes down.